Yep. Hi, I'm Dr. Jane Miller, North Hudson IVF, reproductive endocrinologist. Patients often ask me, gee doc, are my eggs normal? And what they're really asking me is, can I have a normal pregnancy and a normal baby? Sperm and eggs are very different when it comes to the assessment and the answering of that question. Sperm tells us an awful lot when we look at it. In a semen analysis, one of the parameters that we check is the shape of the sperm morphology. And for the most part, normally shaped sperm contain normal DNA. Eggs are not so easy to assess. When we do IVF, in vitro fertilization, and we retrieve eggs, looking at those eggs as we look at sperm, we can only tell three things: if the egg is mature, if the egg is immature, or if the egg is degenerate. And mature eggs are the ones that can fertilize and have the potential to become people. Immature eggs don't fertilize, and neither do degenerate ones. So let's first go into normal physiology. Let's say two people get pregnant the good old-fashioned way. And when that happens, egg and sperm meet in the fallopian tube. Fertilization, that's the easy hurdle. And then from there, it takes 5 days of cell division, during which time that fertilized egg undergoes divisions on a certain time clock, meaning the cells divide, hence the number of cells multiplies. And if that fertilized egg makes it to the 5th day of cell division, it will then be capable of getting into the uterine cavity, burrowing into the uterine lining, developing a blood supply, and that's called implantation. Okay. So what we do with IVF, or in vitro fertilization, is we simulate, we copy what's going on in the person's fallopian tube to mimic those 5 days, but we can see the development of the embryo and see if we have enough stem cells to make a person. So what happens with IVF is that we retrieve the eggs, inseminate them in the laboratory, and watch for those 5 days. We let nature take its course and see at the end of 5 days how many of these blastocysts, the day 5 embryos, are appropriate to biopsy. So let me show you a picture. Okay, you can hear. Okay. This is the journey of a fertilized egg from day 1, the day after it's fertilized, until day 5. Let's just concentrate on day 5. What we see here is an embryo with a lump of cells, inner cell mass, which are stem cells. They make the human being. The cells around the outside, trophectoderm, make the HCG hormone, the beta HCG, that you pick up on the urine test or the blood test when you're pregnant. And also, early on, picks up a sac. If we do an ultrasound of the uterus, we see a little sac in the uterus. That's also from these cells. So when we get to day 5, we have 2 ways of assessing if the eggs are normal. One way is to see if we have a normal embryo, meaning enough stem cells to make a human being, enough trophectoderm cells to make a human being and to biopsy. And so what we do is we biopsy. We take 6 to 9 cells from the embryos that have enough stem cells, but we don't go near the stem cells. We take the cells from around and they go to the genetics lab. From there, we find out which embryos are genetically normal. 46 chromosomes, 46 XX for female embryos, 46 XY for male embryos. Then, with those 2 factors, morphology of the embryo and the genetics of the embryo, we know if the egg that made that embryo was normal or abnormal. This is Dr. Jane Miller, North Hudson IVF. Call us for more information, 201-871-1999, or see us on the web.